the cameras are. If there was a murder on the corner, if there was a carjacking down the street, if there was somebody breaking into one of the banks, we would have cars, we would have all of the news stations here, and everybody would be watching it on the news. But we have a talented group of people who are veterans, 20 years plus of foreign wars, if you will, who have persevered and have stayed in this city to do what's right for the children of the city. So what I want to say to you is give yourself a round of applause for staying here. Said that I said it here now, that all of them should be on the board because the sake of our children's future is at risk. You heard the young lady just talk about mental health services. A huge amount of our practices involve a lot of children who are coming in from fragmented families. They're coming in, they're already on ADHD medicines. They have not even had any follow-up. They have not had any diagnosis tools looked at. They have not been evaluated. And when you put a child on medicine, you put the whole family on medicine. So consequently, this concept of medical home and this partnership with WCHAP will help us continue to do what we needed to do a long time ago, and that is to bridge the gaps that we are missing in our fragmented care. I'm very, very excited to be a part of this simply because even though I didn't want to go to that dinner meeting a while back, I'm excited to be a part of this because this is a collective, collaborative initiative that will put not only Wayne County and the city of Detroit on the map, but it also will be a model that can be used around the country. Janella told me I only had 10 minutes. You know, I'm a Baptist preacher's son, so I'm not going to ask you guys to pass the plate or anything. But what I want to say is that I think that this is an initiative that works, will work, and it will continue to work as long as we have dedicated individuals as you in place.
Let's connect. Let's Connect is a term that we use with pediatric and family health, as well as with the Wayne Children's Healthcare Access Program. And it's the notion that in order for us to do a better job to serve the community, we have to know each other. We have to learn what the services are, the resources, the policies, the barriers that are there, so we can get out of our silos, right? Get out of those silos and begin to come together more cooperatively, collaboratively, to have real impact on a community that is stressed.
The good news is that we have a governor that actually listens to people and takes what they say and considers it and then makes it his own or rejects it or whatever. But he apparently has kind of latched on to P20 as a key strategy to making the world, or our state, a better place for young children. And you know, we know that the dollar spent in early childhood, early learning programs saves the state $16 to $17 down the line for, you know, prison costs and welfare and poor health outcomes, dropouts. I mean, kids, it's hugely expensive for the K-12 system to have kids repeat grades. You know, it's such a waste of a year of expense and effort if a child has to repeat 8th grade or something like that. And those kids are more likely to get discouraged and to leave school and to not find themselves in a position to be able to find their way back into school. I mean, there are so many things that we can and should be doing to help those kids who are struggling in middle school and high school, to whatever tutoring, after-school programs, clinics, and the like that we can do after, you know, to get those kids interested and welcomed and felt that they are worthy of getting an education.
When we go to a provider, we can establish a data dashboard and show them this is where you're at now, how do we change this and improve this without data, without measuring what we do. We really, this is not just a touchy-feely project, this is a data-driven.
People in the audience, as well as both Teresa and I, we believe in this work. And right now, for example, the work that's being done for the medical director has been all pro bono, with some support, obviously, from Children's Hospital. We have members of our WCHAP team, core team, who've been doing the same thing. So we want to move from the wonderful world of volunteerism to having a structure and some predictable staff. data analyst is going to be real important to partner with the health plans. But one of the things that was mentioned on the previous slide is we need to have data systems that float above the proprietary systems that are out there so that we can all extract some aggregate data that tells us how we're progressing. And then we'll have an analyst to hopefully help with that, an asthma educator, a clinical social worker, service coordinator. What are the services? You see them here. That we facilitate behavioral and health triage and coordination. We have a practice manager to help specifically around quality improvement initiatives. Real important, helping families understand, when we did the family focus group, we asked, where do you go for when your child gets sick? Half said they call mom or grandmom, and the other half said ER. So part of the challenge is to educate families that ER shouldn't even be where you go, and here's how to do that. So, and that's one of the successes that Kent has had in terms of redirecting that mind thing. Transportation is going to be very important. Asthma case management, resource coordination, and of course, this monthly dashboard of quality indicators. We used a lot of venues to get input, and our families told us a lot of what we know. One is they want respect. They want compassion. They want hours that work for them and not just for the provider. There were issues of cultural competency, meaning that there are times that they have a physician or medical staff that they can't understand as a result of, it could be accents, it could be the language that they are using, the words that they are using. But one of the things that really stood out is that every single parent and grandparent and dad and uncle that was in that room, all of them wanted information. They wanted information in a way that they could use it to address all the big health issues.
I have a child who, at 2.5 years old, was exposed to meningitis. And there was a meningitis epidemic here in Detroit. Children's Hospital was filled to the rafters. They had kids out in the hallway and everything else. And my daughter was left with an impairment and later diagnosed with developmental disabilities. And I have to tell you, there's no road like that road when you don't know who to talk to or who to call or where to go. So I had the pediatricians, well-known pediatricians, very involved in medicine. And they told me, they said, no, there's nothing wrong with her. Because, see, there wasn't that integration in terms of our pediatricians having that connection with somewhere like WCHAP or having that additional training available to them. They were trained to look at the physical, and so the other piece didn't enter in. And again, she'd come, she didn't have a fever, and she was jumping up and down and happy and everything, but I kept saying, there's something wrong with my child. And so it took me almost 8 years to get her diagnosed and to get her the services and supports that she needed. And I promised myself in the good Lord, if he ever gave me an opportunity to be somewhere, that I could have a pulpit to be able to tell folks that there's somebody out there and that we can do it together, that I was going to do that. And so wherever you need me, Javette, just let me know. I'm going to be there. And I want to just share something with you as a parent. This is my parent hat. I don't know if you can see it. Yeah. It starts on this. It starts right here. That's the front page. And then this is the back page. Now, the reason that I'm carrying around this little thing, and I think it's so important, and it's going to take me, because I'm old, about 20 years to fold it back up. But the reason that I think it's important to share this with you is that this is the insert out of the medication that my daughter takes. And the directions say, read this before you take the medication. Now, I did everything folks told me to do. You know, I went to school, and we got that little undergraduate degree. The folks at the University of Michigan said, we got a little money here, you want to come to school? I went up there, commuted every day, got that little master's paper. I was even inquisitive and went on and got, if I'd ever sit down and write the paper, probably could have that little PhD. I'm telling you, I can't read this. First of all, I can't see it. Second of all, There's no way that you would have a mom who is faced with the fact that they've been told that their child has special needs, be they only physical needs or be they a co-occurring illness, co-occurring mental health and physical health care issue. My daughter has, as I told you, developmental disabilities, and about 3 years ago was also diagnosed with co-occurring mental illness. And I'm telling you that as the director of the mental health agency, I can't read this. And one of the things that I hope, and I know is going to happen because Dr. Holtrup and Jametta are part of this, and Carlin is going to keep them on the straight and narrow. Because, she'll come back and say, well, do we have some money to be able to do this? Let's do this, let's do that. Is to make sure that people have the supports and services that they need to ensure that they're able to feel comfortable that they can take care of their families and meet the needs of their children. We have the right folks at the table, and I really want to thank you again for all the hard work that you have done and for the assistance in terms of launching WCHAP, because I think we're going to put it on the map. Thank you.